contraceptive pills, OCB pills, in which you will be able to have a prolonged barrier method. But here the condition is he had undertaken a sex, but he just don't want to become pregnant. So it's a much more urgent condition. Now in that particular thing, what is one of the drug which is kind of OTC approved, almost many part of the world, including in India, I-pill is actually available, is a levonorgestrel 1.5 mg single pill. Remember, it's just a single pill. So many of the time you would have heard as a morning pill. What does that mean is, let's say the partner had it, next day morning, early morning, they're able to take it. That means they have the very, very lesser chance that the women will get pregnant. It has a maximum efficacy when it taken next morning, but as the time duration actually will goes on, your chance of getting pregnancy will actually get increased. Now let me and if you see this, they would have also explained a bit about how the drug is actually working. Now this is a bit of biology which will be like very nice for you to understand, because you should know, right, when you're taking what occurs is that it delays the ovulation. Ovulation is a release of the ovule, so that it actually binds with the sperm to form the embryo, and then it actually gets implanted in the uterus to actually go as a full-grown fetus. Now, since it delays the ovulation, it will not be allowing the fertilization to occur. Now, plan B, you remember, many of you will be afraid. Now, what will occur if I still get pregnant? If you still get pregnant, yes, there is a possibility of still getting pregnancy, but your pregnancy would not have got affected. Now, this is an important thing, because you will go panic. Yeah, I have taken an OTC. OTC is for stopping the pregnancy. Now, I have still got pregnant, but it's okay. I can now be pregnant. Now, what to do? Now, you don't have to worry. But in the condition that if your next menstrual period, if you are not getting your menses, that means what? There is a delay, right? That means it is likely that you're pregnant. What you have to do, simply go to the healthcare doctor at this particular point of time, because at this time, the OTC will not anymore help. There is no drug as well. You have to consult a doctor, and a doctor will make sure that if you still don't want pregnancy, he will give other drugs or other therapies, like one of the drugs is misoprostol, right? But he can only prescribe it, not us. He'll prescribe it, he or she, whoever it is, the doctor. Doctor will be able to prescribe you, and by which you will be able to know it. So what is it, the entire thing? When you should take a drug, what will be the effect? When you are sure that the drug has not worked, when you should go to the physician. All these are, if you see now, extremely common repetitive steps in different OTC usage. You have to understand and you have to appreciate it for your own usage. Okay. Can you go to the next slide, please, Kathy? Yes. Now, next thing is androgenic alopecia. Now, thinning of hair, or like a loss of hair, right? Or thinning, or like patterns, or like some snubs which are actually present. Very, very common. Around 30 million women in the US alone actually suffer from androgenic alopecia. It's majority of the genetic and hormonal reason. Nothing in you. It's because of the genes which actually coming. One of the drugs which actually a drug which is actually very powerful is actually Minoxidil, 2% to 5% topical. Remember? So this helps in hair regrowth. You can grow. It will actually causes promotion of the growth at the hair follicles which are present beneath the skin. It will cause promotion of it, by which the hair will go. As I already said, when you should initially see if it is responding or not. Yes, it is responding. Then you will take 2 times a day, and how many days you can maximally take? It's only up to 8 months of usage, and you have to, many of the time you will also see, like you will. It is also important to understand couple of concepts. Some of the time after you take a drug, this will be very well explained when I move to the acid reflux. Actually, there are different type of drug. When you take a drug, you will say, yeah, drug did not work. But remember, for every drug, there will be a characteristic time when it will start to work. Some may start to work immediately. Some may start to work some bit of delay. Some may start to work. Some may not even work at all. So you have to know when a drug will start to work. And you should also know when a drug will never work, so that you have to go to the doctor. If you're able to understand this, then you will be exactly saying. Say similar thing over here. If you respond initially, let's say if you initially for the 1 month you did not respond at all, that means minoxidil is something which is not going to help you. You have to visit a dermatologist, and the doctor will be prescribing you a alternative drug which will be like much better for you to treat. Can you go to the next slide, please, Kathy?
Kathy, can you hear us?
Kathy, next slide, please.
Actually, Praveen sir, today we are having a lot of network issues here.
Okay.
And considering these network issues, we surely would like to invite you offline in an offline mode soon here, so that the concepts will be more clear. Kathy, can you move the slide, please? Kathy, are you there? Bacha, you can text in case.
Ma'am, I think her internet got disconnected. She's just trying to get it back.
Okay, okay. Kathy, is the network restored?
No, ma'am, it will just take a couple of minutes.
Okay, okay.
Your voice is not audible, ma'am.
Sorry for the inconvenience, Dr. Praveen. Sometimes the things are not in our hand.
No problem. This is a normal thing. Nothing. This is a normal actually.
Okay. Kathy, now we can see you. I think the network is restored.
Yes.
Yeah, I'm sharing my screen. Is it visible, sir?
Not right, not yet.
Not yet.
Kathy, not yet.
Just a minute.
Praveen sir, should I share? If you can share the PPT, how many slides are left? I think I can try to share you on your behalf.
Yes, ma'am.
Should
Yes,
I?
ma'am. I'm sharing it. I am just putting the link in the meet
Okay,
actually.
okay,
Please.
okay, okay, okay. I'm taken from there.
Sure.
Yeah, now it's with me. I'm sharing.
Okay, ma'am.
Is my PPT visible now?
Yes, ma'am. It
On
is
which
visible.
slide we were?
Ma'am,
Uh,
we were on 13th numbers. Now currently 14th number slide. Yes, ma'am. Perfect. Yes.
okay, okay, okay. Let me just put it in the whole view. Just wait. How it's possible.
Slideshow current.
Okay, okay, okay.
Yes, perfect. Okay, so overactive bladder. I've already kind of given a couple of time example. Let me tell it again. So there is a bit of urgency or frequency or a bit of leakage the women is actually facing. So this is a very characteristic condition with the neurogenic thing, activity of the bladder is so high that there is a kind of discomfort to the women because her urine are getting leaked. Now for this, one of the very good patches actually there is a skin patch Remember, it's not an oral drug, right? It's a skin patch, which is an OTC. That is only allowed. So she takes that patch and she puts it either on her abdomen or on a hip or a buttocks, and then very safe. 4 days, no problem. I've read many of the reviews also of this. Many of the women are also saying come of the very positive thing about this. Yes, it worked. Yes, it not worked. And yes, it was good when it is kind of it doesn't perfectly do it. So it was a good amount of comments which actually there. I would also recommend you to also read at these kind of things to better understand about the usage and other things. Now, how does it act actually? Because there is an overactivity, there will be calming of the bladder. Of course, because it is a muscarinic antagonist, these receptors are present throughout the body. So there will be some amount of dry mouth and constipation, which can also occur with this kind of thing. Always remember, whenever you see OTC, I said couple of principles, right? Where it is used, how it is to be used, what are the safety, when it will start to work, when it will start to work, how much time do you have to wait, when you should not wait or rather go to the doctor. All these are common condition, right? One more common thing, if you see across the different OTC, which will be there, OTC people generally recommend to take along with non-pharmacological conservative treatments. What do I mean with it? Remember things like timed urination, pelvic floor exercises, fluid management. Remember, these are not drugs, nor these are OTC. These are some of the conditions which may be additionally done to get more benefit. So you do some non-pharmacological therapy, take a OTC drug, a combination of both of these will make sure that you will be out of the particular problem. So this is something which is very common across multiple things. If it thinks of acidity, they'll be saying don't take chocolates, don't take spicy food, because in addition to that, if you take a drug, it will be much more better. So that's what the thing. Can you go to the next slide, please, ma'am? Next slide.
Sir, I have shared next one. Why it's not moving there?
Yes,
I
perfect.
did. Okay.
No problem. Okay. So next is. Can you mute, please?
Hello.
Yes, sir.
Okay. So next is vulvovaginal atrophy or vulvovaginal candidiasis. Both are a bit different condition. Vulvovaginal atrophy, especially in women who are attaining menopause in their post-menopausal thing. You know, women, she has hormones, very important, estrogen and a combination of progesterone. Balance of this actually maintains the pregnancy, right? Now the thing is, estrogen is a very, very important hormone which actually is responsible for maintaining the vulval as well as the vaginal softness and also the different characteristic of it. But you know, there is a declining level of estrogen when a woman actually attains menopause. What do I mean menopause? When her menses actually stop, I'd say at 45 years of age commonly, right? Now after this, people generally have a bit of atrophy of the vagina. Now, this is very much discomfort. Why? Because she may have dryness, discomfort, irritation, dyspareunia, which means pain during sexual intercourse. All these problems actually occurring. It would also affect her psychologically and sexually. Now, if you see for this, vaginal moisturizers and lubricants are available, right? As OTC, you can take it and you can actually have it as application. How to apply? You can read the direction, and I would when we actually meet the next time, I would like some of you to actually say how you would actually understand a particular labeling. Remember, you all should know how to read a OTC label. Take time for reading OTC label. Don't just buy the drug and have it. Rather, take time, read OTC label. If you have doubts, read it again. If you're still not clear, ask to any of the healthcare professional like me or any of the thing, get it cleared. But after that, you can be a master of how you manage that particular minor ailment on your own. Next is vulvar or vaginal candidiasis, right? Now, candidiasis. Candida means what? Candida is actually a Candida albicans. It's a fungal, right? Candidiasis is a disease, fungal infection caused by a fungal, right? Now, if you actually see this, it can come as a foul discharge with a discharge, again making a woman very uncomfortable, right? Now, if you see this, there are drugs which are actually coming as creams along with applicators. If you see this, how to actually apply this, there will be around 7 applicators with 1 cream and 1 more external itch cream, right? Every day you have to take the applicator, apply a bit of antifungal first, and then put it on the vagina to make it clean, and then throw away the applicator. Like that you have to do for 7 days. In all this has to be done only once a day, but the external itch can be handled by one more cream. This is, I'm telling about one of the companies which actually sells it. You can take the external itch and then apply it for the itching. A combination of this will actually make sure that within 7 days you will actually get relief. But remember, if you don't feel some relief within 3 days, that's what, ma'am, if you can just move a bit of hide button, just move a bit of hide. Yes. Very cool. Yes. If you know relief within 3 days or no complete relief within 7 days, then this is the time to go to healthcare provider. See, you are able to see the same pattern repeating. You should know when it will start to work, when it will not, when it would have worked, and when it is not working. If you know this nicely, you will be able to self-manage on your own. Can you go to the next slide, ma'am? Now, these are conditions which are very specific for women. Now, I'll be going into conditions which fall into both women as well as men. I'm also very happy that large amount of men participants are also there in the particular call. Now, if you see heartburn, heartburn means what? Stomach contents regurgitating into the esophagus. So there is a mouth, after that the esophagus, after the stomach, after that the intestine, and then finally the rectum and anus, right? Now, if you see stomach content, if it regurgitates out, you will feel very much burning. But remember, you should be able to characterize what is the difference between a heartburn or other chest pain which are of serious condition. But if you are very sure, okay, this is how mine is actually heartburn based on the characteristics, then there is a suite of drugs which are available. Many of these are actually proton pump inhibitor like omeprazole, esomeprazole, lansoprazole. These are available in multiple things. Many of them are delayed release. And then there is also one more group of drug known as H1 blocker like famotidine, or that is in two doses, 10 mg, 20 mg. The ranitidine, because of some adverse events, has been now stopped from being sold. So that has been gone. Famotidine is one of the only histamine blocker which is currently available in the market. How does this act? Basically, in your stomach, there are some proton pumps. These actually secrete the acid. This will go inside and it will block it. So basically, remember that your acidity inside will be stopped. Now you see this, both of this drug, omeprazole as well as famotidine, should be taken for 14 days for the heartburn thing. But see how it is actually differing. Omeprazole is only once to be taken. Famotidine is to be taken twice, right? Both has to be taken 1 hour, 10 to 1 hour before food. If you would not have read the instruction, you would be taking after the food, or you would be taking along with the food. These are all not going to work. What is going to work is when you are going to take 10 minutes to 60 minutes before, because its activation can only occur on the empty stomach, right? So that is why reading of instruction is very, very important. And third thing, if you take famotidine, you will get an action on the same day. But if you take omeprazole, it will at least take 2 to 3 days. It will take some time to really get its action. So if you take first time, if it is not working, you will be saying, yeah, this drug is not working. That is a comment, right? We would be giving, right? But remember, the difference is the drug itself is meant to start working only after 2 days. So if you would have read the instruction, you would have waited for 3 days at least. Okay, third day has occurred, still it is not working. Now it is not working. Then it is very clear. That's why reading instruction is very important to characterize the drug, how it is working. Yes. Ma'am, can you go to the next slide, please? Now, I'll also touch upon other OTC. Interesting. These are extremely interesting. Day-to-day problem we may be facing, right? Anti-diarrheal medicine, diarrhea, right? Traveler's diarrhea. When you actually go, there is some food we have taken. There is some old food because of which some toxin has entered. It may be either Campylobacter, commonly in the southeast, or it can be either Enterococcus, commonly along our parts of region, because of which we got some stomach upset, we got diarrhea. First and foremost, what to do? Even before you take the OTC, have a good hydration. Take ORS or take, like, let's say, salt replenishments, because that is the first thing. Along with that, if it is not stopping, then you can take drugs like loperamide. 2 mg. First is 2 caplet after the first stool. After that, 1 caplet. After every stool on a day, you can take maximum of only 4 caplet, not more than that. Remember? You see, doesn't mean if you would not have read that particular instruction, you may get a bit confused. Remember, instructions are going to vary between drug to drug. You see the next example. This is a third example. Bismuth subsalicylate. every hour you'll be taking 4 tablets. Just only 1 second, Kamini. Let me just finish this particular point. Actually, you'll be taking 4 tablets on a day. Maximum of 16 tablets you can take. So unless until you read the instruction properly, you may not be able to exactly understand how it is to be treated. Yes, Kamini. You have any doubts, Kamini? Okay, let me continue. So this is one of the things in which how you will be able to manage diarrhea. Okay, right? So either loperamide 2 mg or it can be bismuth salicylate, which is one form of medication. Ma'am, can you go to the previous slide, please? Yes.
Yes. This one, no? This one?
Next one. Yes. Now, if you see the water at the bottom, there is a echo. Yes. Now, if you see things like acetaminophen, pain, fever, mild headache, paracetamol, Dolo 650, you would have already think. Now, remember, some of these informations are extremely important. That is why I have written in red. Now, if you see things like naproxen, naproxen and ibuprofen, these are all available at OTC. But remember, in pregnancy, only acetaminophen is safe, not the other drugs. In fact, many of these are not at all safe in the last trimester of pregnancy, to be very, very specific. That is why when you're taking OTC, you should take the OTC, but you should take it in a judicious manner, in a right manner, without any abuse potential, and you should be also following the instruction. That's one of the things over here. Can you go to the next slide, ma'am?
Yes, sure.
Yes. I talked about diarrhea. I talked about pain. Now let's come to 2 more problems. One is constipation. Another is going to be sleep problem. Right now, constipation. There is a drug known Dulcolax. Very common. You would have definitely heard about it. But see, Dulcolax is available in different formats. It can available in tablet. It can, as a OTC, I'm saying, it can available as tablets, it can available as liquid gel, it can available as soft gel, it can available as suppository. You will be confused. Why is so many varieties actually available? Remember, because the usage of each and everything is different. Now, for those who doesn't know what is the tablet, you will be knowing, taken by orally as a tablet, right? Liquid gels, soft gels, all these are just small formulation difference, right? Liquid suppository. What does the word suppository means is when you take the drug and you apply the drug directly or inside your rectum. So that, remember, generally as a tablet, Dulcolax takes 6 to 12 hours for its action. That is, you will take in the night for your bladder to get empty in the morning. But let's say if you want it to be done immediately, you are in a bit of urgency, then you will be taking a suppository and apply. If you take a suppository and apply, it will start within 15 to 60 minutes. It will be very, very fast application. That is why you have to understand, why is there a difference between OTC? It is because some starts early. You know what is constipation, right? Constipation is when you are not freely let loose in your stools in the morning, right? Now, for that particular thing, if you think that night itself you can take the tablet, and the morning you want your bowel empty, then take it as tablet. No, it's a very urgent thing. I want it immediately to be cleared because I'm going to board into a flight, right? I'm not feeling well. Now I'll better take it as a suppository because I have only 2 hours. Within that I'll get cleared, then I'll board a flight. That's the difference. Now you see drugs like for sleep drugs. As you would be taking you heard that there is even OTC available for sleep. How it is possible? Is sleep drugs not abusive drugs? Remember, this is the beauty. I said right in the first initial principles. The drug should be safe and also should have a favorable benefit risk ratio. What scientists have done is when you're taking drugs for allergy, right? You sometimes have a mild amount of sleepiness. You remember? It is because these drugs have the sleepiness as a side effect. Now, what scientists have done is they have taken this side effect and used that for those people who are having occasional sleeplessness problem. Remember, if you have routine sleeplessness, this is not the OTC to be taken. But if you have occasional sleeplessness, you generally sleep nicely, sometimes you don't sleep nicely, then you can take this either the doxylamine 25 mg or diphenhydramine 50 mg as a sleeping aid, 1 tablet per dose, 30 minutes before going to sleep, so that you will actually have a good night's sleep. And remember, these are not habit forming drug, and these are actually safe drugs. Ma'am, can you go to the next slide, please? Ma'am, next slide.
Sir, I have shifted, but it is not showing. I have moved. Okay, yeah.
Okay,
Now
cool.
it's there.
Yes. Now, if you see this, now I'd be talking about the negative aspects of OTC. Last couple of slides, right? Now, you talked about all these things. I talked OTC in a positive format, how we can use OTC for our own benefit. Now, let's talk about some of the things. OTC, some of the time what occurs is, or antibiotics are generally, especially important, and amoxicillin, clavulanate, and things like this, which we actually have are very important drugs. If you develop resistance against that, then it may not work on the day in which you need it importantly. Remember, that is the risk about antibiotic. Please don't take antibiotic unless it is prescribed by a physician after consulting your symptoms, especially for simple things like viral fever. If you take antibiotic or if you don't take antibiotic, the number of days you're going to have fever is going to be the same. Remember, it is not because of the antibiotic your fever came down. It came down because of on its own. At the maximum, you have to take an antipyretic. Pyretic means fever medicine, right? Paracetamol, dolutegravir, right? So irrational usage of antibiotic will lead to antibiotic resistance. And also, some of the times you actually see, right? These are exactly not OTC kind of stuff, but self-medication problems, right? Now, if you would have had previously some problem, you would have had a prescription. You would be saying, yeah, there is already a prescription. Let me repeat this. Now, these are all not the right habits. Remember, because a doctor may actually think it in a different way, right? Why has it come again? Has it flared up? Are there some other problem? Many of the conditions have common symptoms. A collection of symptoms becomes a disease. So symptoms are common across multiple diseases. So always visit a doctor. Don't take it. Some of the practices which are not very common among us, but still just want to give us, like dotching of vagina, are very harmful, where female uses a water kind of fluid inside the vagina to clean it after menses. These are not at all recommended, and it actually causes flare-up of pelvic inflammatory disease. It's a very dreadful disease. So,
Praveen sir, it is a wonderful session going on, but we have another event lined up. So
okay,
we need to conclude. Yeah.
Okay, sure. Okay, sure. Can you go to the next slide, please?
Yes, sure.
Yes. Problem in OTC, let me quickly think. Now, what are the problems? Incorrect self-diagnosis, you have wrongly diagnosed, prolonged suffering, irrational use of drugs, ingestion of inappropriate drug. Let's say you thought of something, but it was something else. So you inappropriately took a drug, right? Occurrence of adverse event, drug-to-drug interaction, drug-to-multiple disease interaction. Very important. Let's say omeprazole. If you are already a heart patient, and let's say you are actually taking some of the drug, let's say warfarin, right? Omeprazole is known to interact with warfarin. If you are not aware of it, and if you did not take to your physician, it will be a problem. So always remember, whenever you are taking OTC, when you go to a physician, inform him that I am taking this OTC on my own. Not a problem, inform him. Can you go to the next slide, please, ma'am? Solution to some of the problem, I have already said a couple of things. Healthcare provider, tell about them. Law of OTC should be there in India to enable the females of India to have this luxury of treating on their own without any prescription, with just a pharmacist or a pharmacy help. Advertisement regarding awareness, like your college is so good that they reached out to people who actually kind of know about this. We also have read a bit to really understand and come back. Like this kind of awareness needs to be many more things. Many females should be made aware on their own, and these education materials should be allowed to be propagated on free for them to better knowledge. Can you go to the last slide? This is the last slide actually. Next slide is the last slide.
Yes, sir. I have just moved. Maybe it's going good. Yeah.
Yes. Now, this is the conclusion, right? So, rational usage of OTC should be promoted in India, similar to developed countries. Okay. Education among women with regards to OTC should be promoted in educational institutions and workplaces. Better informative materials outlining usage of OTC should be developed. The regulatory agency should develop novel ways to still avoid self-medication of things like antibiotics or other. Finally, I would like to conclude, good usage of OTC promotes self-health in human, and it's our duty to outline the path. With that, I would like to conclude my speech. Thank you so much, ma'am. Thank you all. Thank you all.
Thank you so much, sir.
Kathy, I would like to intervene first. Sir,
You
it
very
was the please
sure.
mute yourself, bache, for the timing. Sir, it was a wonderful presentation. Even I just did actually, I inclined myself to read the labels before actually buying the medicine, because we do read sometimes the expiry date, but we are usually limited to just reading the expiry date of the medicine. But yes, we should know about the salts, and definitely, Praveen sir, we need one physical session from you soon. So to make our students aware how to read the various components of medicine, it is very, very crucial, because many of the medicine like paracetamol for the medicine of cold and cough, constipation, sleeping pills are very famous, and I don't think so many times we don't pay the heed to read whether they are legally we can buy like that or not. So it's a wonderful presentation. I regret for all the network issues that occurred,
No,
because
no problem, ma'am. I'll see. These are very, very normal actually. These are not in our control. Not a problem at all.
yes, but it was a brilliant presentation. Thank you so much. Thank you. And I would
Thank you.
really appreciate, can we share this PPT to our participants, sir?
Yes, please feel free to share actually. In fact,
Yeah,
feel
you
free to
can
share.
you can just WhatsApp me so that I can share with the participants.
Sure, ma'am. I'll WhatsApp you right now.
Okay.
Okay, thanks.
Kathy, over to you.
Thank you so much, ma'am. Thank you so much, sir, for delivering such a magnificent session. You very rightly touched on the topics and explained the things very easily to the students. The emphasis on reduction cost by controlling over the counter sales of drugs side of each medicine that we take was very certainly crucial, and it meant a lot to us to have a session delivered by you on such an important issue. Thank you so much, sir.
Thank you all. Thank you. Okay.
Kathy, can we take another group picture? I request all of you to turn on your cameras quickly for another group picture. Please turn on your cameras. Many of the participants still are being shy of the camera, but please, with a big smile, turn on your cameras. All are looking very beautiful, don't worry. Thank you so much. Over to you, Kathy.
Yes, thank you so much, ma'am. Now the floor is open for questions. If anyone has any, they can put the questions down in the
We
chat
have
box, or please
only
join.
2 minutes for taking up queries. I apologize to the participants. Do we have any queries? You can unmute yourself and please ask. So one question from my side, I think it would be for all of us. Usually we take paracetamol at home and we buy from the chemist without any medical prescription. How long we can rely for paracetamol? Like, can we go on for 2 or 3 days if the fever persists? And we should go whenever we are having fever, we should go to the doctor, or we can take the paracetamol on our own.
Very good question, ma'am. Can I just mute? Yes.
Yes, sir. Yes.
Yes. So if you actually see this, this is now, let me say in the context of COVID-19, right? How many days can we actually take paracetamol in the home as compared to the top of this? In all these conditions, what you have to look out is the governmental agency, whenever they are putting any report, right? Especially regular agencies like ICMR and other thing, they'll be giving what is known as the warning signs, right? What are the warning signs of COVID-19? You have very high fever, crossing 102, lasting for lasting for more than 2 days. Let's say you have a fall in oxygenation, okay, less than 92%. Now let's say you have a very severe headache, okay. Now you have to look out for these warning signs. If these warning signs occurs on day 1, you have to go immediately. It doesn't matter. You have to go as soon as you want. You have. But if these warning signs have not occurred, let's say you have a fever. Let's say fever just started, okay. First day you are having fever, I would definitely recommend you take good amount of water, take a paracetamol. That's more than enough. Not an antibiotic, right? Though you would be getting it, not an antibiotic. Wait. Next day also, let's say the fever is still around 99 and 99 and you are still able to manage it. Wait. If it on third day also, if it is there, immediately then it is a thing. Immediately get it tested. And immediately after that, immediately after getting tested, you can then make an online consultation. Nowadays, teleconsultations are very, very common. You can make an online consultation to a doctor to just have a quick view of the things. Many of the times, if for COVID, there is no other specific drugs, you don't have to get any drug. At last, you will just wean off within paracetamol itself, or like Dolo-60, whatever it is, you would have wean off with that by that itself. But I would definitely recommend you can wait for 1 to 2 days, provided you don't have the warning signs. Always remember what is the warning signs. If you know the warning signs, then it is then you don't have to worry. Okay, let me also take on a couple of questions. Sir, are generic drugs equally effective like OTC? Second is, one more question is, how confidently can we go for generic medicines? So okay, so let me say remember, brand name and generic medicine is actually a different concept. That is not similar to OTC. Even within OTC, there may be initial brand OTC on like whatever is the next which has come, maybe generic. But the thing is, what is a brand and generic is, let's say innovator molecule has been approved, right? And after it has been approved, the first brand which has come is known as the brand name. Now, generally, the patent will be effective for 17 years. 17 years will come from the day they have filed patent on the first day. But after that, they have to do the phase 1, phase 2, all the trials they will do. And then they would have gone to the market, approval, and then they are getting. After 17 years, that drug can be manufactured by other companies also. Now, when the drug, after the patent period has gone, when other people are manufacturing, those are known as generic drugs. To my thing, generic drugs are equivalent to brand name. Other things are just our mind related thing, right? Because for generic drugs also, government and pharmaceutical company has regulations like bioequivalence study. What is bioequivalence study is, they will be checking, if you take, they will be getting a set of volunteers and they will be giving the brand name drug. They will be seeing how much is the concentration of the drug in the blood of the patient. Then they will also be giving the generic drug. They'll be seeing how much is the concentration of the drug in the patient's blood. They'll be able to see the concentration of both of that is the same. Only then a generic drug will get approved. So please dispel your fear from generic drugs. Generic drugs, unless until you are getting from a recognized place where you are very sure that, see, remember, generic medicine is not equal to counterfeit medicine. Counterfeit is a different problem. That is a menace, right? That's legally wrong. That if you are not taking a legally perfect generic medicine, you be assured it will be functioning as equivalent to the brand name, because ultimately the composition, API, what we take as active pharmaceutical ingredient, is same across both the medicines. That's what I want to say. And but whereas OTC is going to be over the counter, it's a different thing. You can still have generic medicines which are still Schedule H. Like that is, they are not available as over the counters. Generic and brand is actually based on the approvals and the time period, whereas OTC is based on whether it's going to be prescription or non-prescription based. That is a classification for this.
Sir, in daily routine, which are the painkillers safe to use, usually for headache and all, body ache, which is quite normal, and we don't want to see a physician for that. So which composition would be safe to use?
Ma'am, I don't want to point out on any one particular drug, but if you actually see the slide which I had put, right, there are a couple of options, acetaminophen, right? And there is also option of ibuprofen, right? So all these are actually safe. So
Okay.
you can take it, but remember, abusive usage of NSAID is very, very risky. Can you just mute once? Yes. Abusive usage of NSAID is very, very risky. Remember, ma'am, when you are having, let's say one of the person is having repeated headache or repeated body pain, you have to check what is the reason for it. Are you having some sinus inside? Get it treated, right? Don't take NSAID without.
Yes, Kathy, we are just concluding. We are just concluding. We are just concluding. Sir, we are
Okay, sure.
getting signals again and again. Sorry to interrupt. I think
Okay,
we
okay.
need one more session, and soon we are going to another session of this series in the next
Sure,
month
sure,
for surely, because we
sure,
do have so many questions and we need
sure, sure,
answer. Over
sure,
to
sure,
you,
ma'am.
Kathy, for the formal vote of thanks.
Thank
Thank
you.
you so much, Praveen sir, for being so polite and humble, because I have interrupted you in between. Thank you so much. You are such a nice
Thanks.
person.
Thanks.
Yes, Kathy, for
Yeah,
the
thank you.
formal vote of thanks, beta.
Yes, ma'am. Over to Anmol. She'll be giving the formal vote of thanks.
Thank you so much, Kathy. I would like to thank Dr. Praveen
Dear
Kumar
participants,
for
sorry
taking
to
our time
interrupt.
from his
Sorry to
busy
interrupt, Bache. Sorry to interrupt.
schedule.
You can all post your thank or greetings in the chat box for our sir, Praveen sir, so that he can be happy. I know we like the session too much. So please post your beautiful message in the chat box for our resource person today. Thank you so much. Over to you, beta.
I would like to thank Dr. Praveen Kumar for taking out time from his busy schedule to be the guest speaker at our seminar today. Your literary contribution highlighting the ramifications of drug abuse helped us all magnify the cause in the best possible manner. We are thankful to our principal, Dr. Nisha Bhargava, for having given us the opportunity to organize this session. We are also grateful to our faculty members who took part in the session with their valued presence. I also express my gratitude to our technical staff who helped in the smooth functioning of the event. Lastly, the very basic fiber of the session, the recipients are students who participated in good number to apprise themselves of the nuances associated with drug abuse and also raised queries, thus making the session a fruitful one. I once again thank you all for joining the session today. Have a nice day.
Thank you so much, all. Bye. Take care. Bye.